Bismillahirrahmanirrahim. Assalamu alaikum. This flow and its legs are allowed to dangle. The stretch on the limbs occasionally elicits stepping reflexes which involve all the four limbs. In general, the stepping occurs diagonally between the four limbs and hind limbs. This diagonal response is another manifestation of reciprocal innervation, this time occurring the entire distance up and down the cord between the forelimbs and hind limbs is known as the mark time reflex. Then there is a galloping reflex in which the both forelimbs move backward in unison while both hind limbs move forward. This often occurs when almost equal stretch or pressure stimuli are applied to the limbs on both sides of the body at the same time. In walking, only one forelimb and one hind limb at a time are stimulated. The animal continues walking. Conversely, when the animal strikes the ground during galloping, both forelimbs and both hind limbs are stimulated about equally. The animal keeps galloping and therefore continues this pattern of motion. Then we have another term that is known as the scratch reflex. Now what is it? An essentially important cord reflex in some animals is the scratch reflex, which is initiated by itch or tickle sensation. It is initiated by an itch or a tickle sensation. It involves two functions: a position sense that allows the paw to find the exact point of irritation on the surface of the body. It is a highly developed function, a to and fro scratching movement. Spinal cord reflexes: muscle spasm resulting from a broken pain. The spasm results from pain impulses initiated from the broken edges of the bone. Muscles that surround the area to contract tonically. Pain relief obtained by injecting a local anesthetic at the broken edges of the bone relieves the spasm. A deep general anesthetic of the entire body, such as ether anesthesia, also relieves the spasm. One of these two anesthetic procedures is often necessary before the spasm can be overcome sufficiently for the two ends of the bone to be set back into their appropriate position. So you should be knowing about the pathophysiology of muscle spasm due to the pain. So you can be asked that, do you need any sort of anesthesia before operating on a broken bone? So answer is always yes. Why? Because they want to relieve the muscle spasm over there in order to do the approximation of the broken edges of the bone. Then we have abdominal muscle spasm in the peritonitis, a local spasm caused by cord reflexes in abdominal spasm resulting from irritation of the parietal peritoneum by peritonitis. Relief of pain due to peritonitis allows the muscles to relax. The same type of spasm often occurs during surgical operations. For example, during abdominal operations, pain impulses from the parietal peritoneum often cause the abdominal muscles to contract extensively, severely, sometimes extruding the intestines through the surgical wound. For this reason, the deep anesthesia is usually required for intra-abdominal operations. So you can be asked about do you think that there is clinical application of muscle spasm So scenarios can be asked from these conditions. Then we have the muscle cramps. Any local irritating factor or metabolic abnormality of a muscle, such as severe cold, lack of blood flow, or overexercise, can elicit pain or other sensory signals transmitted from the muscle to the spinal cord. And they are going to lead to reflex feedback muscle contraction. Dog contraction stimulates the same sensory receptors even more, which causes the spinal cord to increase the intensity of contraction. Thus, a positive feedback develops, so a small amount of initial irritation causes more and more contraction until a full-blown muscle cramp ensues. Then there is presence of autonomic reflexes in the spinal cord. Many types of segmental autonomic reflexes are integrated in the spinal cord, which include the changes in vascular tone, resulting from changes in the local skin heat, sweating, resulting from localized heat on the surface of the body, intestinal reflexes, which control some motor functions of the gut, peritoneal-intestinal reflexes, which inhibit gastrointestinal motility in response to peritoneal irritation, evacuation reflexes for emptying the full bladder or the colon. All the segmental reflexes can at times be elicited simultaneously in the form of so-called mass reflex. So you can be asked about what is a condition known as mass reflex. So what is it? Mass reflex is the collection of so many segmental autonomic reflexes taking place simultaneously. A mass reflex in a spinal animal or human being, sometimes the spinal cord suddenly becomes excessively active, causing the massive discharge in large portions of the cord. The usual stimuli are strong pain stimulus to the skin or excessive filling of a viscus, which can be overdistension of the urinary bladder or overdistension or fullness of the gut. Regardless of the type of stimulus, the resulting reflex is a mass reflex, which is involving large portions or even all of the cord. The effects are the major portion of the body's skeletal muscles goes into strong flexor spasm. The colon and bladder, they are likely to evacuate. The arterial pressure often rises to maximal values, sometimes to a systolic pressure well over 200 millimeters of mercury. Large areas of the body break out into profuse sweating. Because the mass reflex can last for minutes, it presumably results from activation of great numbers of reverberating circuits that excite large areas of the cord at once. One of the most important of all circuits in the entire nervous system is the reverberatory or oscillatory circuit. Such circuits are caused by positive feedback within the neuronal circuit that feeds back to re-excite the input of the same circuit. Once stimulated, the circuit may discharge repetitively for a long time. Now, another very important university question, that is, what is spinal shock? Or what is spinal transaction? So time and again it is being asked in university exam over there in the Viva as well, that what are the different features which you are going to see and what will happen. So when the spinal cord is suddenly transected in the upper neck, at first, initially, all cord functions, including the cord reflexes, immediately they become depressed to the point of total silence. So you can say that there is a complete stoppage of any sort of cord reflexes immediately after the transection, and this condition is known as spinal shock. Because the normal activity of the cord neurons depends on the continual tonic excitation by the discharge of nerve fibers entering the cord from higher centers, particularly reticulospinal tracts, vestibulospinal tracts, and corticospinal tracts. After a few days or few hours to a few weeks, the spinal neurons gradually they regain their excitability. There is a natural characteristic of the neurons everywhere in the nervous system that after they lose their source of facilitatory impulses, they increase their own natural degree of excitability to make up at least partially for the loss. In most non-primates, excitability of the cord centers returns essentially to normal within a few hours to a day or so. In human beings, the return is often delayed for several weeks and occasionally is never complete. Conversely, sometimes recovery is excessive, which results into resultant hyperexcitability of some or all the cord functions. Now, the spinal functions which are specifically affected during or after spinal shock are: at the onset of spinal shock, there is instantly and drastic fall in the blood pressure to up to 40 millimeters of mercury as a result of blockage of the sympathetic nervous system activity. The blood pressure ordinarily returns to normal within a few days' time. All skeletal muscle reflexes integrated in the spinal cord are blocked during the initial stages of shock. In lower animals, a few hours to a few days are required for these reflexes to return to normal. In human beings, 2 weeks to several months they are sometimes required. In both animals and humans, some reflexes may eventually become hyper-excitable, particularly if a new facilitatory pathways remain intact between the brain and the cord while the remainder of the spinal cord is transected. The first reflexes to return are the stretch reflexes, followed in order by progressively more complex reflexes like flexor reflexes, postural antigravity reflexes, and the remnants of stepping reflexes. The sacral reflexes for control of bladder and colon evacuation are suppressed in human beings for the first few weeks after cord transection, but in most cases they eventually return. So, this is all about today's lecture and what we have done in today's lecture, which are very important. They are like stretch reflex, pain reflex, withdrawal reflex. What is the concept of reciprocal inhibition? Then what is scratch reflex? What is muscle spasm? The clinical implication of muscle spasm. What is the importance of this muscle spasm related to surgery? Then one of the important questions like spinal shock, what will happen immediately after transaction and how come the reflexes they come gradually over the period of weeks and months or so. So this is all about today's lecture. God bless you all and thank you very much.